Culture and mental illness. Culture and mental illness are deeply interconnected, influencing how individuals experience, express, interpret, and seek treatment for psychological conditions. Culture encompasses shared beliefs, values, customs, behaviors, and social norms that shape the way people think, feel, and interact. Mental illness refers to a wide range of conditions affecting mood, thinking, behavior, and emotional regulation, including depression, anxiety, bipolar disorder, schizophrenia, and many others. Understanding the role of culture in mental health is essential for providing effective care, reducing stigma, and promoting psychological well-being across diverse populations. Cultural factors shape how mental illness is perceived and understood. In some cultures, mental health conditions may be interpreted through spiritual or religious frameworks, viewing psychological distress as a result of moral weakness, divine punishment, or possession by supernatural forces. In other cultures, psychological symptoms may be explained in biomedical terms, emphasizing biological causes such as brain chemistry, genetics, or neurological dysfunction. These cultural interpretations influence how individuals label their experiences, whether they recognize symptoms as a mental health issue, and whether they seek professional help. Misalignment between cultural beliefs and clinical approaches can create barriers to diagnosis, treatment, and adherence. Culture also influences how symptoms of mental illness are expressed. People from different cultural backgrounds may display distress in ways consistent with societal norms. For example, in some cultures, emotional pain may be expressed primarily through physical symptoms such as headaches, fatigue, or stomach problems, a phenomenon known as somatization. In other cultures, emotional expression may be more verbal, with individuals openly discussing feelings of sadness, worry, or hopelessness. Cultural norms around emotional expression, gender roles, and social expectations affect symptom presentation, making it essential for mental health professionals to consider cultural context when evaluating patients. Social and cultural expectations can impact the development, course, and outcome of mental illness. Stigma surrounding mental health varies across cultures, affecting help-seeking behavior and social support. In some societies, mental illness is highly stigmatized, leading individuals to hide symptoms, delay treatment, or rely on traditional healers instead of medical professionals. In cultures with greater acceptance and awareness, people may feel more comfortable discussing mental health concerns, accessing services, and adhering to treatment. Family and community support, cultural coping mechanisms, and religious or spiritual practices can either protect against or exacerbate psychological distress depending on the cultural context. Cultural factors also influence the availability and effectiveness of mental health services. In many low- and middle-income countries, mental health resources are limited, mental health literacy is low, and culturally appropriate interventions may be scarce. Even in high-income countries, cultural minorities may face language barriers, discrimination, or lack of culturally competent care. Mental health professionals who are unaware of cultural differences may misdiagnose symptoms, overlook important contextual factors, or provide interventions that are inconsistent with a patient's beliefs and values. Culturally sensitive care involves understanding the patient's worldview, respecting cultural practices, and integrating culturally relevant strategies into assessment and treatment. Cultural identity, including ethnicity, religion, language, and social customs, can shape the experience of mental illness. Cultural identity provides a framework for understanding the self, interpreting life events, and forming social connections, all of which influence resilience, coping strategies, and vulnerability to psychological distress. Strong cultural identity can offer protective benefits, such as community support, spiritual guidance, and meaningful engagement in cultural practices. Conversely, cultural marginalization, discrimination, and acculturation stress can increase susceptibility to mental health problems, particularly among immigrants, refugees, and minority groups. Cross-cultural research in mental health has revealed both universal and culture-specific aspects of mental illness. Some conditions, such as depression and schizophrenia, are observed across cultures, suggesting underlying biological and psychological mechanisms. However, the prevalence, symptom expression, course, and interpretation of these conditions can vary widely. For example, depression in Western cultures may present predominantly with emotional symptoms like sadness and guilt, whereas in some Asian cultures, depression may manifest more frequently through somatic complaints and social withdrawal. Recognizing these cultural variations is critical for accurate diagnosis, effective treatment, and culturally informed public health initiatives. Culture also influences treatment preferences and approaches to mental health care. Some individuals may prefer psychotherapy, medication, or a combination of both, while others may rely on traditional healing, religious practices, or community-based interventions. Effective mental health care often requires collaboration between biomedical approaches and culturally endorsed practices. Culturally adapted psychotherapies, bilingual providers, community mental health programs, and the inclusion of family and community support can enhance treatment engagement and outcomes. Mental health education that is culturally sensitive can improve awareness, reduce stigma, and encourage early intervention. In addition to individual treatment, public health initiatives must consider cultural factors to promote mental health at the population level. Awareness campaigns, school programs, workplace interventions, and policy initiatives should be tailored to the cultural beliefs, values, and communication styles of the target population. Engaging community leaders, religious figures, and culturally relevant media can enhance the reach and effectiveness of mental health promotion efforts. Recognizing and addressing cultural determinants of mental health, such as socioeconomic disparities, discrimination, migration stress, and social norms, is essential for reducing the burden of mental illness and promoting psychological well-being. In conclusion, culture profoundly influences how mental illness is perceived, experienced, expressed, and treated. Cultural beliefs, values, and social norms shape symptom presentation, help-seeking behavior, stigma, treatment preferences, and recovery outcomes. Effective mental health care requires cultural sensitivity, awareness of cross-cultural differences, and integration of culturally relevant practices into assessment, intervention, and prevention efforts. By understanding the role of culture in mental illness, mental health professionals, communities, and policymakers can reduce stigma, enhance access to care, and support recovery. Promoting culturally informed mental health awareness and intervention empowers individuals to manage psychological distress, seek help without fear, and achieve greater well-being. If you found this explanation helpful and informative, please like this video and subscribe to the channel for more educational content.